Yeah, I guess you guys both mentioned how how this pandemic has really changed how services are provided. So, looking into the future, how can we prepare for medical emergencies like this pandemic, or what can we learn from this pandemic that might help us better prepare ourselves in the future?
I think that's a great question. I would hope from this pandemic, we've learned the importance of investing in public health initiatives on multiple scales, both national, regional, and global. I think that a couple main points that we can learn are that we need increased communication and coordination in terms of a global response when things like this start to evolve. And I think another huge piece is, like Nick talked about, the mobilization and distribution of resources and looking at that supply chain and how that operates and how to improve that. So I think that those are two big pieces that I would hope we would learn lessons from this pandemic.
Yeah, definitely areas of preparedness and being able to, yeah, like Madeline said, the communication, but also then the action and taking proper action more immediately. You're seeing that with some countries around the world that took what seemed at the time very drastic measures and very quick measures. You're seeing now the successes that are coming out of those countries. I think I saw the other day that New Zealand has cleared, I think, their last case, which I know that they took things very seriously there. So I hope that can be a model for other countries and just countries in general. I think that taking it more seriously and reacting a bit more quickly can really lessen some of these issues and problems that we're seeing later down the line.
Yeah, so all things that we need to definitely consider for preparing for medical emergencies like this in the future. And now, I guess for currently, we can talk more about the field of public health. We see that now public health is often underfunded and the research is limited. Could you tell us a bit about what public health entails and where do you see the field progressing after this pandemic?
Yes, so public health in general is the overall health of a population, normally looking at, specific region or country or community. It combines efforts to promote health, protect and control health risk factors, and prevent diseases on that larger scale. And so when you're thinking about where we see this field progressing, again, the hope is really that more of an investment is made in public health, in seeing all of the pieces that are incorporated into public health and not just the medical piece. There are so many factors, including things like social determinants of health, that impact the health of a population. And so being able to invest in all of those pieces is really important in terms of improving health on a community, all the way from an individual community scale to a global scale. And so hopefully from this pandemic, we'll see the field progress in terms of financial investment, in terms of resource investment to improve our ability to really address those issues.
Yes, Madeline definitely made some great points there, and I think gave some great definition around the large topic that can be public health and global health, because it does not only touch on areas of health-related issues, but also thinking about that social side, the political and economic side, and really how there can be equity made within a community, within a country and across the world in areas there too. So thinking ahead of what we can do next or what we might see coming out of this in the future, I think there'll be a lot of emphasis in areas of like recovery, research, and prevention and mitigation activities, and how to balance that overall, because for many places, this will take a long time to recover, and that recovery will look very different depending on where you are or where your activities will be. So I think there'll be a lot of emphasis on recovery activities. Then too, in areas of research, I mean, we're seeing that right now with vaccines and improved testing and a wider range of testing capabilities, and that infrastructure being there to pivot more quickly to address situations like this. Looking at the prevention on how to avoid situations like this altogether, and if we can't avoid something, what action steps can we take to mitigate them from reaching the levels that they've gotten to today? Also, too, thinking about how to balance, like, this is not the only thing that's happening in the world right now. There's still many other things and health issues and political issues and social and economic issues that are happening. So how does this get balanced in the world and communities that providing good attention to a situation that we're seeing right now, but also with supporting initiatives like around HIV prevention, malaria, infrastructure, sanitation, all those areas that are still actively in need of support.
Yeah, like you mentioned, like public health is definitely seems like the intersection of a variety of disciplines, and does involve a lot of communication and interaction between the disciplines. And like you mentioned, something that we should learn from the pandemic is being able to have that communication, to be able to act faster in like curbing something like the pandemic, not just the health effects, but other like socio-political effects as well. I guess just I was just wondering, so like based on what you know from like current pandemic measures that governments and countries have taken, have you seen like any country like focusing on a public health viewpoint or taking a perspective towards handling this pandemic?
So I think every country has taken somewhat of a public health approach, or has tried to take somewhat of a public health approach in being able to address the pandemic. It's things like implementing the quarantine. There's things like implementing quarantine in different ways. So, for example, Peru had at one point tried a quarantine measure where genders were allowed, or different, depending on how you identified, but males were allowed out on one day, females were allowed out on another day, to try to be able to better track who was going in terms of tracing back the virus, which is an important part of epidemiology and public health as well. That certainly didn't turn out the way that they expected, and so that measure was only implemented for a few days. But I think that countries have tried to respond from somewhat of a public health perspective, but it just is the lack in preparedness in the systems that have prevented people and countries from being really effective in public health measures.
Yes, and as well too, there are certain areas and certain countries that have been dealing with similar situations at different times as well too. So Uganda's neighbors to the west, the Democratic Republic of Congo, they've had to deal with over the years different levels of Ebola outbreaks as well too. So they've had some preparedness plans both within country and internationally as well too, working with different partners on how to, when something like that comes up, how to address it, how to mitigate, how to isolate. And so there's some countries that have been able to leverage existing practices and apply them in situations like this. But as Madeline was saying, a lot of people and a lot of countries are learning along the way. There are a lot of places that haven't had to experience anything like that. So in moving forward, I'm hopeful that things will change in that respect, and greater levels of preparedness will be taken to address possible situations like this in the future.
Great. Thank you so much for those insights. I think just before we end off this podcast, so for those for our listeners who are interested in learning more about public health and who are interested in getting involved with FIMRC, how can people get involved with your organization right now?
Great question. So right now, as we mentioned, we primarily have virtual volunteer programs that are running. And so if people are interested in learning about public health, global health, and how FIMRC operates within those fields around the world, I certainly would recommend looking at the different program options at our website, and being able to sign up for one of those programs is going to be able to have that much of an impact. And so that's kind of the main piece. If you're interested in just learning more about FIMRC, our website is www.fimrc.org. And so that's really where I would mention to get started. And then from there, we're able to work with you and figure out what you're really passionate about and how that can positively impact FIMRC's operations around the world.
Great, thank you. And we will also link the website on our episode bio for people if anyone's interested in looking that up.
For now, that concludes our episode of Unmasking COVID. A very special thank you to Nick and Madeline for joining us today and giving us insight into who FIMRC are and what they're doing in light of COVID-19. Another thank you to our listeners for tuning in, and for anyone wanting to join us on our show, you can fill out the Google form on our Facebook page. See you next time.